T1C, coronal. Plan the coronal slices on the axial plane, angling the planning block parallel to the line across the metacarpal bones. Check the planning block in the other two planes. An appropriate angle must be used in the sagittal plane, parallel to the metacarpal and phalangeal bones. The slices must be sufficient to cover the entire hand from the dorsal to palmar aspect.
T2 stir sagittal. Plan the sagittal slices on the axial plane and angle the planning block perpendicular to the line across the metacarpal bones. Check the planning block in the other two planes. An appropriate angle must be used in the coronal plane, parallel to the metacarpal and phalangeal bones. Slices must be sufficient to cover the whole hand from medial aspect to lateral aspect.
T2 stir axial. Plan the axial slices on the coronal localizer and angle the planning block perpendicular to the metacarpal and phalangeal bones. Check the planning block in the other two planes. An appropriate angle must be used in the sagittal plane, perpendicular to the metacarpal and phalangeal bones. The slices should be sufficient to cover the entire hand, from the tip of the fingers to the line of the distal radio-ulnar joint.
Indications for hand MRI scan. Marrow abnormalities, for example, bone contusions, osteonecrosis, marrow edema syndromes, and stress fractures. Synovial-based disorders, for example, synovitis, tenosynovitis, bursitis, and ganglion cysts. Infections of bone, joint, or soft tissue, for example, osteomyelitis, osteoarthritis. Neoplasms of bone, joint, or soft tissue. Avascular necrosis. Nerve impingement. Fractures in children. Soft tissue masses. Occult fracture. Ganglion cyst. Ligament tear. Contraindications. Any electrically, magnetically, or mechanically activated implant, for example, cardiac pacemaker, insulin pump, biostimulator, neurostimulator, cochlear implant, and hearing aids. Intracranial aneurysm clips, unless made of titanium. Pregnancy. Risk versus benefit ratio to be assessed.